When someone you love is in the ICU, the world shifts. Time feels strange. Machines are louder than conversations, and you find yourself staring at equipment you never wanted to understand. Today, I want to gently walk you through that room, not medically, not academically, but humanly. This is what's happening and what it means. The first thing most families notice is the noise, beeping, air moving, and pumps clicking. It can feel chaotic, but it isn't chaos. It's information. Every sound a signal, every number has meaning, and every machine has a purpose. And there is a trained team watching all of it. One of the first things you might notice is the ventilator. If your loved one is on a ventilator, that can be the hardest thing to see. It's a breathing tube and machine moving their chest, medications keeping them sedated. A ventilator does not mean the end. It means the lungs need help. When someone is critically ill, breathing takes enormous energy. The ventilator temporarily takes over that work so the body can focus on healing. It delivers oxygen and removes carbon dioxide. It also keeps the lungs open. They get sedation while on the ventilator. This is used for comfort and safety, not to silence someone, but to prevent suffering and allow the support to work. The goal is always the same: support, stabilize, and reassess. Then there is pressors, supporting blood pressure. You may hear the team say, and we've started pressors. They are medications that support blood pressure. When someone is septic, bleeding, or in shock, blood pressure can drop dangerously low, and without adequate pressure, and organs don't receive enough blood flow. Pressors gently tighten blood vessels to maintain circulation. They are not a sign of giving up. They are a sign that the team is actively protecting the brain, the heart, and the kidneys. Sometimes they're temporary, sometimes they're part of a bigger fight, but they are used carefully and monitored constantly. You may also see another machine and hear the term CRRT. This stands for continuous renal replacement therapy and is a gentle form of dialysis used in critically ill patients. When blood pressure drops or infection overwhelms the body, the kidneys can struggle. CRRT runs continuously and slowly, helping remove fluid and toxins. While the body stabilizes, think of it as buying time. Sometimes kidney function returns, sometimes it doesn't. But in critical care, time matters. Next, who are the people in the room? The machines are visible, but the coordination behind them is less obvious. In that room, you'll see an ICU nurse, often caring for just one or two patients, watching every detail, a respiratory therapist who manages the ventilator, a pharmacist who is adjusting medications minute by minute, and a hospitalist, intensivist, nurse practitioner, or physician assistant involved in guiding the overall plan, consulting specialists when needed. Behind the scenes, there is also lab teams, imaging staff, case managers, social workers, and chaplains. It may look overwhelming, but it is structured, coordinated, and deliberate. In the ICU, you'll often hear the word stable, but what does that mean? In the ICU, stable doesn't always mean better. It also means not worse right now. And sometimes that is progress. Critical illness is rarely a straight line upward. There are improvements, there are setbacks, and there is waiting. The ICU is dynamic. Plans adjust, medications change, and numbers can shift. Uncertainty is part of it, but questions can help. If you find yourself in that room, there are grounding questions you might ask, such as, what are we most worried about today? What are we watching closely? What could improvement look like, and what would concern you? Clear questions bring clear answers, and clarity reduces anxiety. Under all the wires and tubes is still the person you love. That, that is the human side. The nurse speaks to them while adjusting medications. The respiratory therapist handles them gently, and the provider studies their labs late at night. Critical care is technical, but it is not cold. It is focused, intense, and it is human. The bigger picture is some people leave the ICU and some don't. The ICU is where medicine pushes its limits and where technology supports failing organs, where families hope fiercely, where teams work hour by hour. So if you ever walk into that room again, I hope you see differently. The ventilator is support, the pressors are protection, the dialysis machine is time, and the people around the bed are not strangers running machines. They are a coordinated team working toward one goal: stabilize, support, and reassess. This has been Beyond the Stethoscope, and I'm Arn Facklam, nurse practitioner and fellow of hospital medicine, helping you understand what happens behind the scenes. So if you ever find yourself in an ICU room, you feel a little less overwhelmed and a little less alone.